DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
Welcome to DMH NewsLink. I'm your host, Michaela Hunt. As so many of us know, we are facing a crisis throughout the country, an opioid crisis, pain medications being abused. And we are so fortunate to have Dr. Francesco Vetri with the DMH Millennium Pain Center with us here today to talk to us a little bit about what's going on. So thank you so much for spending some time with us.
It's my pleasure.
So Dr. Vetri is a chronic pain specialist.
That is correct.
Tell us, what's the difference between chronic pain and acute pain? How do we know?
So acute pain is a pain that occurs after an injury or a surgery. Many reasons for having acute pain. Then the chronic pain is when beyond the normal amount of time that is normally necessary for healing, the pain persists. So to say you have chronic back pain and it lingers for years.
Lots of people have this. So as a doctor within the center, how do you effectively treat this pain while also thinking about the addiction risk that's out there right now?
Absolutely. So the way we address the pain is multidisciplinary in nature. So we refer the patient to psychologists. We have a strong physical therapy department in the hospital. We do use as a first line non-addictive medication, okay, like anti-inflammatory medication or antidepressant. Many different kinds of medications, and we also have a vast array of interventions that we offer in the pain clinic to help to avoid patient actually being exposed to opioids.
So if I'm a patient that is dealing with chronic pain, what is the conversation that I need to be having with my doctor?
The conversation is based on the pain, of course, but also like the function, you know, what is the ability of the patient to do things and what are the limitations in doing the normal activities of daily life or the pleasurable activities. So those are the things that we keep into account when we kind of have to elaborate on where the patient can be helped with.
We're going to take a left kind of for a second and talk about medical marijuana and chronic pain. Each state has different stance on medical marijuana. Mm-hmm. Given what the Illinois legislature has decided with all of that, mm-hmm. what is your take on medical marijuana use for chronic pain?
So unfortunately at this point in time there's no enough evidence that medical marijuana is safe and efficacious in treating chronic pain. There's been many studies, but none is really definitive. But the same thing can be actually said for opioid medication. So that's kind of like, you know, we're trying to shift from one type of addiction to a different kind of addiction, and that could be dangerous in itself.
If a family is worried, again, back to pain pills, if they're worried about a loved one and that loved one may have become addicted to pills, where do they go for some support, and what are some of the definitive signs that they can really look for prior to going to get that support?
So the support is typically, you know, from counseling from addiction specialists, and then we may refer the patient who we think might be getting into that problem. And in terms of monitoring the patient, we have several things in place in terms of questionnaires that we give the patients every single time when they are on opioids with us, urine drug screens, so to make sure the patient is using the medication as prescribed, is not using illicit drugs. And if we suspect, or some family members sometimes they voice their concerns to us, then we'll actually have a frank conversation with the patient and then kind of figure out what the best way to go is.
Dr. Vetri, thank you so much. So much to cover. We got a little of it done today, but we appreciate your time.
Oh, my pleasure again.
And for more information, go to dmhcares.com/news.